That's all right, mate. I mean, I remember compared to what he was like when I last saw him at home a few months ago, he was really struggling with the breathing and he was really rapid. But the breathing seems a bit more settled compared to the last time I saw him.
That's good. That's what I want to hear.
Chromosome 3p deletion syndrome is rare in itself, but Frankie actually has a particular type of deletion called 3p25, which, if you look at the literature, only 50 cases have been reported since the first case was found in 1978. The most common problems include difficulties with breathing, which we saw that Frankie had, but also some structural problems with the way that the heart forms. There are also difficulties with feeding and gaining weight, and later on in life there can also be difficulties with learning and behavioural problems as well.
Like I mentioned, I mean, compared to the last time I saw Frankie, his breathing actually isn't that bad.
Yeah.
I think he does tend to sort of suck in a bit from what I recall of seeing him, and that seems to be his normal. But actually, at the moment, his temperature's down, and actually, in terms of his symptoms, I think actually he's doing all right.
That's good.
Obviously, if at any point he does develop a fever, or you're worried that his breathing is worsened, then obviously we can see him as an emergency. Or you can, ring 111 if it's out of hours. Okay.
The long-term prognosis, it will be a challenging course for Frankie, undoubtedly, but he's got specialist input and he will have the right sort of care right the way through his development to ensure that he is able to live as fulfilling life as possible.
Thank you very much.
Yeah?
Good man. Does that sound good to you? Yeah?
Yeah.
Yeah, tell your mum.
Okay.
Cheers, mate. Thank you.
All right, take care.
You too. Bye-bye.
Bye-bye.
Have a seat.
I'm out of work because so sorry I'm a bit dirty.
No, that's okay. That's no problem at all, sir. I'll just introduce myself. My name's Vijay. I'm one of the clinical pharmacists at the practice. I've just brought you up. So you're here for a medicines review, sir?
Am I? Okay. That's what you say.
Okay. So you take a few different medicines for different things. Diabetes, blood pressure, cholesterol. Is that correct?
You say so?
Yeah. I think, yes, some of your medicines have expired, so that's probably why you're here for review as well. In terms of your medicines, how have you been with those? Are you taking them regularly, sir?
Yeah, every day.
Yeah, okay, brilliant. Now, diet-wise, are you conscious about what you have, or...?
Don't tell me to lose weight because it's not happening. Tell that now.
Okay.
I don't eat that great. I eat fish, chicken, diet drinks if I have any. Trouble is, I can't exercise. I've got nerve damage in both my legs, which I go to the hospital quite often to have epidural jabs with steroids in and that.
Okay.
I just can't swim. I can't ride my bike now. I can't go out for long walks.
Okay.
Can't do sit-ups, nothing like that, so...
All right, so that you can't restricted with that.
It all depends what goes in my mouth.
Yes. Do you have alcohol, sir?
Yeah,
How many...
as much as I can get down my neck.
do you smoke?
I do, but I've got onto the vape and I'm down to about 3 now.
Okay, so you're looking to
So,
cut down.
yeah,
then.
I'm trying to stop completely.
So we need to kind of look at how we can bring this blood sugar down. Try and stick to fiber and stuff. It's more filling, it's more healthy, saturated fats. From a tablet's point of view, glycoside, we could probably look at adjusting the dose to see if we can bring the blood sugar down. After that, we would probably have to consider insulin at some stage. I don't know what your thoughts on that is.
No, I'd rather go without that.
Yeah, no, it's...
It ain't going to happen. I only live once. If I'm going to die next week, I'll die. Don't worry about it.
That's fine.
Definitely.
Okay.
I've got to be on death's door to take that. And I might only be here another 5 years anyway. I'll be in my box by then.
Okay, not to worry. I'm sure you live much longer than that, sir.
I very much doubt it. You don't live with my wife.
Okay.
Doctor, as you know, I'm diagnosed with Crohn's disease.
Yes.
Okay. I used to see Dr. Diore regularly. Yes. She wasn't available today, so I've come just to see herself today. I had 5 periods of loose bowel movement over the 2 days yesterday. Yesterday was 5 a.m. and 5 p.m.
Yeah.
And today was all in the morning, 3 a.m., 5:30 and 8:30 in the morning.
Mm-hmm.
A bit concerned, obviously, because that has just come about now.
Yeah.
I'm on steroid medication,
Yeah.
and that's prednisolone after being discharged from hospital. I've got
Yes.
letters here.
Crohn's disease is, in essence, an inflammation of the bowel. It presents generally as diarrhoea, sometimes blood in the stool, a bit of weight loss, abdominal pain. It's a difficult condition because there isn't actually a cure. I think we're betwixt and between here. Do you understand what I mean? We're waiting for starting the new medication called Humira.
Humira, Humira.
Yeah. And I think that's good news because it sounds like your Crohn's is not properly controlled at the moment.
No.
We need to wait, okay, until you start this. When patients are under the care of specialist teams, if they come to see the GP in the middle of this, it can actually be quite difficult. You want to give the specialist team free rein to manage. That's why they've been referred in the first place. And so there can be some difficulties when managing patients in those circumstances of shared care. The problem with Crohn's is when it's not behaving itself, it can be very difficult for patients. And I think we need to wait until it's...
Wait for the blood test results and then see how that's going.
Yes.
All right, sir.
Okay. Any worries, come back and see us.
All right. Okay.
Okay.
Thank you very much, Doctor.
Cheers. Take it easy.
Doctor.
Bye-bye.
All right.
Bye-bye.
Have a nice day.
Bye-bye.
Susan Edwards, please. Hi, Susan. I've got a medical student with me today. Come on in.
She's got to learn.
Thanks for waiting. Dr. Tawana, nice to see you. I think I've seen you guys before, yes. How can I help today?
I keep getting headaches.
Okay.
I've had, I don't know, MRI.
Okay.
This side doesn't really want to open. They admitted me last June because they thought I had a stroke.
Yes.
It turned out they said I had a Horner.
Right. Horner syndrome is where you've got a trio of symptoms. Those include one of your upper eyelids drooping. You have constriction of one of your pupils, and you can also get loss of sweating to one half of the forehead.
It's come back again. I've had a headache now since Sunday.
Yeah.
The weakness has come back.
Right.
I can't. I'm a mess.
So, important questions that I need to check with you. Any fevers, any rashes that have come out of the blue? Any vomiting in the last few days? Good. This headache that you've been experiencing, allowing you to sleep at night? Waking?
Sort of.
Sort of,
yeah.
OK. With Horner syndrome, there can be lots of different causes. To name just a few, you may be thinking of things like multiple sclerosis, tumours in the brain, inflammation of some of the arteries of the brain, herpes, zoster or shingles type infections. My immediate thoughts would be, I think we need to get you seen by the hospital specialist, just because potentially we need to make sure that we're not missing anything. I'm going to just check some of the nerves that come off the brain, just to see how they're functioning. So what we're going to get you to do, focus on my finger, and as I move the finger in closer to you, just keep following the finger. Here we go. Great, OK. Now, keep looking at the finger. I'm going to steady your head. Keep following it, just your eyes now. If at any point you see double, please let me know. Good. Two up here. OK. Clenching your jaw shut. And then open and clench. Good. Can you hear this? Yep. OK. There is that little bit of weakness around the eye muscles on the right-hand side there. You're seeing double in the corner of that right eye. Are you happy for me to speak to the hospital team? I think we need to get you seen. And it does sound like it could be a Horner syndrome, I think, the Horner syndrome again. Yeah, you had that last year.
They put me in overnight.
OK, fine. Oh, hi, my name's Dr. Tawana, GP at Farnham Road Surgery, Slough. I've got a patient, 60-year-old, in the room with me, just a bit concerned about a headache that she's developed. That's lovely. Brilliant. Thank you very much for your help. Cheers. Bye now. OK, so I'll do a kind of a referral letter. They will see you in the ambulatory care department, which I think is next door to the A&E department. So if you go straight there. Today, yes, they'll be expecting you.
I haven't wasted your time by coming.
Not at all. No, definitely not. We need to get you checked out and seen. OK. Good luck up there. You're welcome. You're welcome. Take care.